everyone, this is Dr. Hub. Today we are going to see the anxiety disorders. So under anxiety disorders, firstly we'll be looking at what is known as a panic disorder. So under panic disorder, we are going to see some important features. So the first one being, there is a recurrent and unexpected panic attacks with greater than 4 of the features. So there is recurrent. So you can say there is recurrent as well as the unexpected panic attacks. Recurrent and the unexpected panic attacks and greater than 4 of the following features. So what do you mean by greater than 4? Greater than 4, it includes a dyspnea. Next is a tachypnea. Then comes palpitations. So any of the 4 of the followings. So it can be palpitations, then it can be sweating, and there can also be presence of dizziness, chest pain. Then comes the tightedness. There can be tightedness. There can be parathesis. There is emotional and cognitive symptoms, as well as feeling that something catastrophic is going to happen. So feeling of catastrophe. So all this greater than 4 can indicate the panic attack. Next point is, there is at least one attack followed by one or both of the following. So there is at least one attack. So there is at least one attack followed by one or both of the following. So it is greater than 1 month. So what are the points? So the points include, there is worry about the additional panic attack. So worry about additional panic attack or consequences. Next will be the changes in behavior related to attacks. So there is changes in behavior related to attacks. So example would be the avoidance. So what is the third point in case of the panic attacks? So next point will be, panic attack is not attributable to the substance abuse. So panic attack, it cannot be attributed to the substance abuse or another medical condition Next is, the panic attack is not explained by another mental disorder. So panic attack, it is not explained by another mental disorder. So how do you treat this panic attack? So this treatment is by the immediate. So what do you have in case of immediate? In case of immediate, we give the benzodiazepines. And in terms of long term, what we do is we give the SSRI as well as the SNRI, or there is a cognitive behavioral therapy, that is a CBT. So now under anxiety disorder, we saw about the panic disorders. Next, we will move on to the phobias. So what happens to the phobias? So in terms of the phobias, there is the exaggerated anxiety response. There is a exaggerated anxiety response that occur during the exposure to relatively innocuous stimuli or situations. So there is exaggerated anxiety response that occur during the exposure to relative innocuous stimuli or situations. And there is a specific phobias entail the phobic responses to particular stimuli, or so specific phobias entail phobic responses to a particular stimuli. So they are associated with a particular stimuli or the situations. Next, we would go to the social anxiety disorder. So what is meant by the social anxiety disorder? So social anxiety disorder is also known as the social phobia. So here there is a phobic response to the specific social situations. So for the specific social situations, this occurs. Lastly, we will look at a very important, that is the generalized anxiety disorder. So in short, we are calling it GAD, generalized anxiety disorder. So there is excessive worry about a variety of topics. So there is excessive worry about the variety of topics. So what does this topic include? It includes job, it includes health, it includes finances. So this occurs greater than 6 months. So there are 3 or more symptoms of the following points. So they can include restlessness, then it can be the fatigue, it can be difficulty concentrating. Next, there is irritability, there can be the muscle tension, or there can be the sleep disturbances. So disturbance in the sleep. So how do you treat this general anxiety disorder? So the treatment here is by, there is a first line treatment. So what is meant by the first line? We administer CBT. Next, there is a SSRI as well as a SNRI. So then we'll move on to the second line for the general anxiety disorder. So the second line will be, it includes the benzodiazepines, then also the buspirone. So this was about the anxiety disorders. We saw some disorders such as the panic disorder, phobias, social anxiety disorder, as well as the GAD. To learn and grow daily like this, please do subscribe.